Welcome back to the podcast, It's Not You, It's PCOS. Hi, I'm Lora.
And I'm Nick, and today we're diving into the IVF journey, what to expect, how to prepare, and most importantly, what you can do now to give yourself the best possible chance of success.
We're thrilled to be joined by Dr. Jenny Cook, a fertility specialist and the clinical director of Monash IVF in Bondi, Sydney. She has over 20 years experience in gynecology, fertility, laparoscopic surgery, and she brings so much clarity, experience and compassion to this topic. Dr. Jenny, you were actually recommended by our listeners and our followers on socials to tackle this topic. So I'm really appreciative of your time and delighted that you can walk us through what to expect when you're going through IVF.
It's my pleasure. Let's get into it.
All right. So IVF success, what does it actually mean? So Jenny, when people first start exploring fertility treatment, they're often bombarded by IVF success rates. But what do they actually mean? So are they positive pregnancy tests or embryo transfers or live births?
Yeah, that's a really good question. In fact, the only statistic that means anything is what is my chance that I'm going to have a live baby, we call it a take-home baby, a term pregnancy. But the statistics are often presented, because that's a very delayed statistic to collect, you have to wait 9 months. The statistic that's often reported is the clinical pregnancy rate per embryo transfer. Clinical pregnancy is defined by a heartbeat generally after 7 weeks. We look at our own figures in our own unit on a quarterly basis, and I mean, I'm pleased to say they've just come out and I'm right at the top of them, and that's really exciting.
Well,
and we're always looking at ways we can improve it, and I'm always thinking of things that I can do differently.
That's incredible. That's incredible to hear. As hopeful as IVF is, sometimes it doesn't work. Sometimes it doesn't work the first, the second, and for some the third. What is considered normal? Is it wise to have this conversation where we understand what is normal?
Yeah, that's a fantastic question. The success of IVF is related to a woman's age. So women in their 20s have got more good quality eggs, and they're going to get pregnant a lot sooner. In rough terms, and these are fairly standard statistics all around the world as well, if you're in your 20s, the pregnancy rate is about 50% per egg collection. So I'm just talking about one IVF cycle, one egg collection. For a woman in her 30s, it's about 30%. That means that 90% of women in their 30s will be pregnant within 3 egg collections. It tends to happen that women 30, 31, 32 probably get there the first time, whereas a woman who's 39, I always say, have it in your mind, you're going to give it 3 goes. You don't give up after the first one. We're just waiting for that right wave of eggs to come along that's got that right egg in it that's going to, create your baby. And for a woman in her early 40s, so up to about the age of 43, it's 10 to 12 or 15% per egg collection. And the numbers don't work out, but again, if it's going to happen, 90% of the time it tends to happen within 3 goes. But women in their 40s will generally do more egg collections before they achieve a pregnancy.
Yeah, that makes complete sense. And it's great that you're setting expectations for your patients at the same time. We as dietitians and fertility dietitians love this thing called epigenetics. So,
and I love it too.
It's absolutely fascinating that, what you're doing, both the male and the female preconception can have such an influence on conception, as well as bringing a baby to full term and then into childhood and then adulthood as well. It's absolutely phenomenal. So I guess what I'm trying to allude to here is essentially preparation is absolutely key. And Laura and I talk about the power of preparation, and the science absolutely backs it up. So when it comes to eggs and sperm, obviously their potential impact on lifelong health, preconception this egg and sperm preconception and its impact on lifelong health is just absolutely critical to this whole process.
Yeah, and I think a lot of people don't realise that. As a fertility specialist, I'm dealing with the woman, I'm dealing with the couple. Sometimes it's a single woman, sometimes it's two women, and I'm dealing with the process of getting them pregnant and doing and improving egg quality and sperm quality is absolutely key. But you forget that that is going to have a knock-on effect for that baby and that adult later in life. They've linked the incidence of hypertension and all sorts of medical conditions to exactly what you're talking about. And I'm dealing with the fertility, but I stress there is a knock-on effect.
Absolutely. And I think, the more we have these conversations, the more we're going to raise awareness about that, diet and the role of diet and lifestyle, and starting that early. We do know that the 90 days prior to conception is that critical window where we can influence egg and sperm health, and it's a great time to start having these conversations about potentially what dietary patterns that you're doing at the moment, and perhaps adopting something like the Mediterranean diet is a good place to start. Yeah.
No, absolutely. And that's the main one that I talk about. The time that there is really an opportunity to do that is the woman who comes in to have her fertility assessed, or the woman who comes in to talk about egg freezing. That's an opportunity to look at lifestyle, to look at what women are doing, to talk about the diet, to look at their weight, their levels of exercise. I suppose we can cover all of this later. But in many ways, the couple or the woman who comes in who is having fertility issues, they want to be pregnant then and there. And there is definitely a pressure to start to do something now. And it's when it doesn't work, that's when you press pause and say we need to wait 90 days. In fact, it should have happened before. But that's what this is about, opening up the conversation. Start now. Absolutely.
It's something that a lot of women say, I wish I was told about this earlier, and I wish I could have started, making dietary choices better earlier. And we do have some science that does show how impactful the Mediterranean diet can be. So we've seen that following a Mediterranean diet more closely, there's a 40% increase in pregnancy rates.
Yeah, I believe it.
Yeah. There's 2.7 times greater chance of clinical pregnancy, improved embryo quality, and higher live birth rates, which is ideally, this is what we want to achieve. And we've seen that with men too, following the Mediterranean diet. We've seen that can be quite helpful for improving sperm quality. So it's something that you guys can do together if you've got a male partner. It's, the more support, the better.
Do your viewers know exactly what the Mediterranean diet is, or it's something you talk about all the time? Is that right?
We do, but we probably should recap. Yeah. So the Mediterranean diet is fundamentally rich in really healthy fats like the extra virgin olive oil, and we also have fish as the prominent protein. And we also have a diet rich in legumes and whole grains, as well as fruits and vegetables, well higher than the Western diet that we would expect. So
and low in processed carbohydrates.
Low in processed carbohydrates, that's right. So it's really rich in anti-inflammatory properties, antioxidants, fibre from all these plant foods that also support the gut microbiome, which we love. So
that's a whole other story. That's a whole other conversation.
We won't totally touch on that, but it's really low in ultra-processed foods and really complex carbohydrates, which is, again, going to be great for somebody who's wanting to improve their overall health. And we do have that data that a Mediterranean diet is great for longevity as well, and all sorts of aspects of health.
Absolutely. Can I ask, you would have variations of the Mediterranean diet according to different cultures, like a cultural influence there. What would you say to someone from Southeast Asia? Here am I asking the questions. It's not my podcast.
Maybe,
but these are relevant questions. Or someone, from a Middle Eastern background.
Yeah, for sure. Laura, I'll take this one if that's okay with you.
Go for it.
I do see a lot of patients that consume cuisines from all around the world, and at the end of the day, as dietitians, we tend to work in serving suggestions. So with serving suggestions, they're so broad that generally any food from any cuisine can really fit into those serving suggestions, so that the patients or the clients are achieving their nutrient needs because they're getting the right balance of all the different food groups still.
Yeah. Well, look, I'm pleased to say that the Mediterranean diet is the one that I recommend. High in protein, good fats, and low in processed carbohydrates. Perhaps I don't go into as much detail as what you do, but I also work very closely with a dietitian, and I will take the time to ring the dietitian to go through the case, to explain what has happened before and what we're trying to achieve, and then we all work on it together.
Oh, I love that. I love hearing that. And yeah. I will just add, the Mediterranean...
It takes a village, isn't it what they say? It takes a village.
It takes a village. Yeah. And I'll just circle back in terms of seeing a dietitian. Our role is really to personalise nutrition information and the science. So a Mediterranean dietary pattern, we're really adopting the pattern. We're really taking the principles of that way of eating and adopting it to any cultural background, which is so possible, but particularly when we're talking about improving whole grains and legumes and more plant foods. That's something that I find quite easy for most people to do once they have the skills and know what they're looking for. So I think that's incredibly important, that whoever you do see, that they're able to personalise the treatment and have people on their team that they're collaborating with and they're all on the same page.
Yeah, I couldn't agree more. The other thing that I would recommend, so a lot of the supplements that we would talk about would be just extra what you've already spoken about. So antioxidants, I would recommend coenzyme Q10. There's some evidence that DHEA, an androgen-based supplement, will improve egg quality. I also recommend niacinamide and melatonin. It's all got something to do with the anti-aging process and antioxidant activity.
Yeah, I tend to recommend quite a few of those too, but obviously it's tailored to the individuals, isn't it?
Yes.
So, Jenny, in a perfect world, wouldn't it be great then if your patients, before they came to see you, did a good 3 months of following this Mediterranean-based meal pattern? So you didn't even have to try an IVF cycle or a ovulation induction treatment, and then say take a break, and then why don't you look at lifestyle? Wouldn't it be great if they just came in straight away with that already under their belt?
Yeah, and I absolutely, because by the time they come in to see me, there's generally an issue, and like I say, there's pressure to do something, some sort of treatment. They want to be pregnant then and there, but the valuable time was actually in the months leading up. And I'll say again, the real opportunity is a woman who comes in just to have her fertility assessed. She's thinking about planning a pregnancy in a couple of years. That's the time. Or a woman who does egg freezing. Those women will often say, I want to get as much benefit out of this as possible. I'll press pause. What can I do to improve my own health and my egg health prior to egg freezing?
So Jenny, you've actually seen, from a clinical perspective, you've actually seen couples take that time to work on nutrition and lifestyle, and you've seen it have a positive role in IVF?
Absolutely. No, absolutely. We just look at everything. Like I say, diet, the amount of exercise they're doing, that's something important to cover.
Awesome.
And their weight is the other thing.
Absolutely.
And that's a really difficult topic because many women, I think, will comfort eat because they're depressed, they can't get pregnant, and then we start pushing hormones, and that's got an effect on their weight as well. And then I turn around and say, your weight is now having a negative impact on what we're trying to achieve. But it's all about how you express it, a meaningful conversation. Let's press pause. We can reap the benefits later on.
Yeah, we definitely discuss. We definitely hit those topics a lot in our work. And it is, really working with the client to help them achieve that alongside their fertility timeline. So that really does, we do have to look at what we can do in those timelines and the best way to do that. I did want to talk about egg freezing. Lots of women are, now being more aware and empowered to make that choice and being a little bit more proactive. And so it's become more popular. What advice would you give? Yeah, so do we. We do love it too. But I guess, since we've been talking about preparation and what they can do, what's some advice you can give about some considerations they should think about? Age, egg quality. Yeah.
There are so many things. Egg freezing presents so many opportunities. It's more than just walking in and having your eggs frozen. It's an opportunity I take a detailed history, looking at anything that is going to potentially have a negative impact on a woman's fertility later on. Does she have regular cycles? Is there possibly polycystic ovaries? Does she have pain? Is there possibly endometriosis? We do the full workup. I give her some idea about what her fertility is as we are there at that moment. Are there any fibroids that we need to keep an eye on? What is her weight? Does she smoke or drink or vaping or anything? We would address all of those. What is her diet like? What is her level of exercise like? But I think most importantly, what is her time frame to have a baby? Egg freezing is not a guarantee of pregnancy. Again, the success of egg freezing is related to a woman's age. So a younger woman is more likely to have good quality eggs. An older woman is going to have fewer good quality eggs. But the woman who has paid attention to her lifestyle and is just having a healthy lifestyle, like we say, antioxidants, all the good fats, she's going to have a more positive outcome as well. And that's the woman who has really got the time to say, as I keep saying, let's press pause and work on that, but let's set you up for the rest of your fertility journey.
I love that. Thank you, Dr. Jenny. Look, really, before we wrap up this episode and dive a little bit deeper into PCOS, do you have one message you want people to walk away with when it comes to preparing for IVF?
Have a plan for your fertility. Take care of yourself. Medical science can't achieve everything. That's actually the medical science is not 100% effective. The only outcomes that we can actually improve are the egg quality and the sperm quality, and that's what we need to work on. Look at your lifestyle, look at your diet, look at your weight, look at smoking and alcohol, look at all of that. Address it now and for the rest of your life, for a baby now and for the health of that baby and that adult later in life too.
Awesome. Such wise words, Jenny. Thank you very much. In our next episode, we'll talk about IVF through the lens of PCOS, how it's different, what to expect and what to focus on when preparing. And Jenny will be back for that one too, which is so cool. So thank you, Jenny, for offering up your time today.
Thank you, and it's been my pleasure.
And to our listeners, thanks for tuning in to another episode of It's Not You, It's PCOS. And if you like this episode, as always, please follow and share, and we'll catch you next time. Bye, guys.
Bye.